All right, we are now live.
We are now live, and we're going to give folks a moment to join in on us. We want to apologize up front. We were a little late. We had some technical difficulties. What we are carrying from 2020 into 2021 is this understanding of Zoom and podcasts and how that stuff works out. And so we are learning quite a bit here on the fly, building the plane while we're or flying the plane while we're building it. I think that's the way that saying goes. But giving folks an opportunity to chime in here, jump in with your questions. We will have an opportunity at the very end of this to actually do some Q&A about the fund. But again, we're here excited about celebrating 5 years of the Flint Kids Fund establishment. Over 20,000 donors from all 50 states, 15 different countries, all branches of military helped us to raise over $19 million to support kids and families impacted by the water crisis. The founder of that fund is with us here today. Some very informed members of community are with us here today. I don't know if they want us to bring up their last position before retirement. So I'm going to say very informed and esteemed members of our community are here with us today. And then some staff from the Community Foundation of Greater Flint. Again, we'll jump into the conversation in just a moment, but we wanted to offer an opportunity for folks to chime in and share with friends as we give an update on what's been happening, not only the establishment of, but what's been happening with the Flint Kids Fund. And so if you don't mind, we're going to take the first few minutes just to introduce our guests, and I'll allow everyone to kind of introduce themselves. I'll do a brief introduction and then I'll allow everyone in order to kind of introduce themselves. So today we have with us the amazing, world renowned now. Oh, don't make the eyes like that. Oh, world renowned now, Dr. Mona Hanna-Attisha, who served as the founder of the Flint Kids Fund and a fierce advocate for Flint kids and families over the last 5 years. But I would say if you read the book, and you should, you know that this has been a life journey for her. We also have with us Ms. Cheryl Thompson. Sorry to have to go through this part, but retired Deputy Director of Field Operations and Mission Flint from the Department of Health and Human Services. And then we have Sue Peters, now Vice President of Community Impact at the Community Foundation of Greater Flint. But she'll probably tell much of the story of coming as a director of special projects, with that special project being water crisis focused work that the Community Foundation was learning to navigate. And so we have our three amazing guests. We're going to have a number of questions, I'm sure, from the viewing audience, but I'm going to throw to you, Dr. Mona. Dr. Mona, as the founding donor, if you remember this, and I'm going to tell a quick story, you remember you were going on Rachel Maddow that evening, the evening of the establishment of the fund, and you wanted a tiny URL to promote the work that was happening. We'd had some conversations about how dollars needed to be set aside for the long-term support of Flint kids that were impacted negatively by the water crisis. We were talking 0 to 6-year-olds impacted by the crisis. You've done tons of tests and shared tons of data with our community about what was happening with this cohort of children and what we had to do to protect and support them and their families. You were going on Rachel Maddow that evening, and you wanted to make sure that you had something to support the fund. And from that moment until now, we were on and popping. And so from there, Dr. Mona, if you can not only maybe retell that story, but also talk to us about the work that you've been doing over the last 5 years and its connections to the Flint Kids Fund.
Absolutely, Isaiah. It's great to be here. It's great to be here with everyone. I can't believe it's been 5 years. I'm so glad that we are taking a moment to celebrate. I think as a community, we work so hard. Our sleeves are always rolled up, and we are working 24/7 to really ensure that to really reflect on how far we've been able to come. Can you guys still hear me?
I can now.
I think my AirPods went crazy. So, like Isaiah said, this has been a year of technical difficulties. So, we're also trying to figure out how to make things work. So once again, I'm just excited to be here. I'm excited to take this opportunity to reflect and to celebrate and really pivot towards the next 5, 10, 15 years. Our work is long-term, and that notion of long-term work is really how this fund was started. At the peak of the crisis, when it became known really to the extent of what was happening, the generosity of the nation was evident, and we started receiving water bottles from the whole country. like the, ballroom dance group in Ann Arbor sent water bottles, and the UAW in Cleveland sent
Well,
water
just wait a few seconds for the email and then go on.
We were, I think someone's, like the, ballroom dance group in Ann Arbor sent water bottles, and the UA. Can we mute everybody or no?
Yeah.
So, so that, that generosity of the nation, just like in so many of our national crises, was so evident. And then I think we started to think like, this is amazing. This is heartwarming. Yay, we're getting all these water bottles. But the crisis that, we just uncovered wasn't a crisis that was going to be solved by just water bottles. If you understand the science of trauma, if you understand the science of what lead does, we knew as a community that we needed more, and that we needed to create some sort of resource to ensure that our children are cared for years, if not decades. And I think there was part of me early on that like wished I could just like prescribe a magic pill. Like, can I just like prescribe like an antidote that can take away this crisis, that can take away this exposure? But there was no magic pill. And the treatment moving forward was this holistic response that the Flint Kids Fund it was founded on, was this response really based on the science of child development, based on the science of trauma, based on the science of what we know helps children. So that was kind of how the Flint Kids Fund was born, as what we affectionately always call this Tomorrow Fund, making sure that the Flint kids had the brightest tomorrow possible, not only recovered from this crisis, but thrived after this crisis. We knew we needed a short name. We needed something catchy. We needed something we could share. And as I was about to go on to the Rachel Maddow show in December of 2015, and as I went on a bazillion other interviews, media interviews, and got a chance to talk to folks all over, we needed something short and catchy, and it became Flint Kids. Even though the longer name is the Flint Child Health and Development Fund, it also affectionately became known as the Flint Kids Fund. So that's a bit how it was born. It was born really based on science, based on what kids need, and based on the long-term trajectory of our children.
Yes, and I'll say the Community Foundation had been in this community for a long time, but we hadn't had a lot of national attention. And I would say due to Dr. Mona's influence and the donors' willingness to support Flint children and families and really love financially on giving, we always talk about time, talent, and treasure, but lots of folks sent us hugs via gifts to support our kids and families that were impacted. And we became a trusted source for a number of donations. Again, I gave the numbers earlier. Just over $19 million from over 20,000 unique donors from all 50 states, 15 different countries, and all branches of military. And some of those gifts represented 15, 20, 30, or 40 people that were giving one single check. So I'm arguing hundreds of thousands of people love Flint by giving gifts to support this work. And as we developed the committee and the committee structure around this, we quickly formed an advisory committee with the goal of really getting grants out the door fast, and also thinking about the long-term nature of this. We talk about 2 generations or 2 10-year periods or 20 years, and the science that Dr. Mona just walked us through really became the core or the foundation upon which we built our grant-making framework. At that time of developing criteria for grant making under the guidance of not only the advisory committee, but Dr. Mona, we hired Sue Peters. And Sue, if you can tell the story of just when you were first hired and the work that you walked into.
Yeah, so there was this night where I got this text message from Isaiah, and we had worked on a project, a phone call, I think, or a text. It might have started with Isaiah, probably a text, but and he said, "Hey, Sue," and we hadn't worked together for about 3 years. And he said, "Hey, Sue, I have this idea for you." And I said, "Okay, well, I'll at least listen." But little did I know it would take me to where I am now. And I will tell you at the same time, so to what Isaiah said, is this has changed the Community Foundation forever. This was one of the largest funds and probably the largest undertaking in grants to be responsive in a crisis that the foundation had taken on. So when I stepped through those doors, there was a couple things going on. The money was coming in, amazing gifts. Some of the gifts and the letters are just, it was prisoners who gave their money for making license plates. And I swear, every time we saw Dr. Mona, she was shaking out her pockets and bringing more money from some group she had talked to. It was just amazing. But at the same time, so we were trying to raise $5 million. We had a match from the Charles Stewart Mott Foundation to raise some additional dollars. So the matches could be met one to one. So I was writing proposals left and right to the Fords. They were all foundations were invited to participate. But to Ford, you name it, Kresge, Skillman, all of them. I had never written so many proposals. My first one in, I think within the first week, was $1 million from Carnegie. So I had to keep that track record going. So, but at the same time, we are trying to bring the money in at that exact same time, trying to figure out the best strategy and the right interventions to get the money out the door. With this balance, as Dr. Mona was saying, of making sure we got the money out the door to meet immediate needs, but with tomorrow in mind, knowing that we weren't truly going to see the impacts on children and family for a long time, right? And that was the goal of the fund. So it was this really interesting balancing act. It was really fast and furious at the time. But boy, enjoyed the work, enjoyed working with the committee. And we learned so much from this to take into this year when we set up the relief fund. So I could say so much more, but Isaiah, I'll just leave it there.
Actually, I'm gonna prompt you to say a little bit.
Okay.
Because we did, as we started or began the work, we really started to formulate into these 4 different quadrants or 4 different areas of focus. And so we
Yes.
had to make sure that we got our grants screened into those areas of focus, because the science suggested that we needed certain things to happen broadly at a community-wide level for our kids. And we were making grant making in those buckets. You not only worked with a consultant to make sure that we had what we
Right.
needed, but we also worked with the scientists. Quite frankly, we worked with the Greater Flint Health Coalition and members of the
Yes.
Greater Flint Health Coalition to create the committee and the boxes that we will be doing grant making out of. Talk a little bit about that process.
Sure. So I'll start with that. Dr. Mona scared me. No, I'm kidding. But really, we had an amazing committee. And these were the experts around the field, like the Dr. Monas, who had raised the flag and said, hey, something's wrong here. So they were advocates and they were much more abreast of information in the field. So I honestly had to work really hard to keep pace with them and stay in front of information. But we did. We worked with our committee, who were the experts, to help us devise the strategies that are still in place for the most part. They may have tweaked a little, but really education, access to healthy food, medical homes, and then also family supports broadly, also including breastfeeding and that access to healthy food. So I really worked with the committee to put those in place. And I will tell you the one word, evidence-based. If I didn't learn anything from Dr. Mona, evidence-based. This committee, if I brought anything that was not evidence-based, I might as well just walk right back out the door. See, I told you she scared me. No, I'm teasing. They knew that. I think it was driven by the fact they knew where the money and the donations were coming from. And I took that on as well, that I felt an obligation to make sure that we spent this money the best that we could. Folks worked so hard to give it to us that I wanted to make sure we met the intent of getting things out the door quickly, but with the long term. I mean, and we made some initial grants. I think they were, what we did initially was as broad as we could, get the impact to be as broad as we could, to reach as many families as we could. Mindfulness is one of those examples, to give some tools across the schools for students to help self-regulate. We also really worked on Dolly Parton's Imagination Library to get books in the hands of students. Dr. Mona actually started that by doing a Shark Tank pitch contest out in Aspen.
Yes.
And then we grew a big project from it. So it was really broad, and we worked from there. Now, did we get it right? I'd hope so. We did have tough conversations with residents, I'm not going to lie, who said, you know what, I need immediate needs right now. This isn't it. And so we worked, it was really a tough balancing act to really try to meet the needs that we saw as long-term and continue on that path.
Yeah, and I like to when I can call people out by name, and so I'm awfully thankful to a number of people. I saw Diana Kelly had jumped into the Zoom, and
good.
thanking folks like Diana Kelly and Kenyatta Dotson, who helped to ground us in community. So it's important to have that balance of folks who understand the science, right? The Dr. Mona, the Kirk Smiths of the world. So thank you, Kirk. Obviously everybody knows
Dr.
Dr. Reynolds holds us all to the fire. But then you have Jamie Gaskin with the United Way, also with the Greater Flint Health Coalition, who was very, very involved from a philanthropic perspective during the water crisis. And then you round that out with some folks who understand the community foundation world, like George Wilkinson, who just rolled off of our board, and Wanda Harton, right? And so you get some folks who genuinely care, but offer different perspectives. And they really began to push. At that time, it was Sue and I And I also always have to give thanks to my predecessor, Kathy Horton, who was very thoughtful very early on about making sure we formulated a committee and a structure that worked to support kids not only now, but over the next 20 years. Because right now we still have another 15 years of that work behind and ahead of us. So we have to have the appropriate structures in place to support kids and families long term. Dr. Moan, I know you were probably going to say something about the projects we were funding.
I was going to say the exact same thing that you said. So as much as this work and the foundation and the philosophy of the Flint Kids Fund has been science and evidence driven, based on what kids need to be healthy and successful, this work, like really all of our work in Flint, has been done with community, with very deliberate community informed, community participatory, community driven decision making. So it's been a really wonderful blend of both things that have come together to be able to do this work and to be so successful at dispersing these funds.
Yes, and so if you would just talk a little bit about, I know Sue talked a bit about mindfulness, and I saw some folks from the Cremon earlier, how we really thought, okay, we know that the science suggested kids would have some issues with discipline and that kind of stuff, but we can't afford to do one-to-one, and I'm looking at Cheryl kind of nodding here. We can't afford to do a whole bunch of guidance counselors in every school. We can't afford that model, but what we can do is be thoughtful about practices that everyone can actually engage in across the board, whether it be teachers early on in the class day, recreational teachers in the evenings, principals and administrators, or after school programming. So we work very closely with folks like the folks at the CRIM to make sure that we had not only citywide, but in some cases countywide programming that was happening to support Flint kids. But we also had another very unique program called the VIP program. Dr. Mona, if you want to talk a little bit about the VIP program that we funded.
Sure, I would love to. So, the science of what happened in Flint, the water crisis, the population-wide lead exposure, was an added trauma atop of a population already rattled with so much trauma and toxicity. Not just the toxicity of lead exposure, but also toxicities of things like poverty and racism and unemployment, unsafe neighborhoods and lack of nutrition. All of these bad things impact the health and development of children. And the more and more that you have these bad things, especially in early childhood, the worse, potential outcomes may be. So we knew that we wanted to intervene very early on in childhood, because that's when you have the greatest impact. And we wanted to do it in a very positive and strength-based way. And one of those interventions is the VIP program that was funded through the Flint Kids Fund, as well as some other foundations. It stands for Video Interactive Parenting. It's led by Dr. Lauren O'Connell, who is a development and behavioral pediatrician here in Flint, with the Pediatric Public Health Initiative. And her kind of niche is positive parenting. She's a toxic stress interventionist. So how can we mitigate, how can we block toxic stress? And she's doing that through the work of parenting support. So in clinic, when kids come in for checkups, after every checkup, they're afforded an opportunity to meet with an interventionist who sits down and talks with the caregiver and the child. It's all very positive, and it supports families and gives them developmental tools to go home with. So this is an evidence-based program. It was started out in Boston. We've been doing it now here in Flint. It's now it's gone virtual with the pandemic, and that's actually allowed it to spread to even more clinics. So the Video Interactive Project is one example of a positive, evidence-based intervention that this fund has supported that's now replicated. So much of what we're doing with the resources from this fund are not only helping Flint kids, but they're actually helping kids all over the nation. Because what we've learned, for example, from this project is being adopted and translated in so many other communities where kids are also growing up with some of those same kinds of toxicities, be it poverty, be it racism, be it environmental exposure. And we're telling them, hey, we did this and this worked, and this is how successful it's been, and these are things that you can do in your community as well. So I think one of the benefits of this fund that we sometimes forget to talk about is that, yeah, it's really helping Flint kids, but it's also really helping kids all over this country.
It's interesting that you say that, Dr. Mona, because it makes me think about, and Sue is often reminding me that we got to be thinking about off-ramps to larger pots of resources or more sustainable pots of resources. And so how are we partnering appropriately? And we talked about this early on, and we continue to have the conversation. policy recommendations. How do we engage in conversation about how we leverage what we're learning here to support the broader population? And so the nurse family partnership program makes me think about things that we leaned into. That was already in operation, it was already existing, but we began to fund that because we saw overlaps between the work that was happening in that space and supports that needed to be offered to Flint kids. If you can talk a little bit about the nurse family partnership program.
Yeah, absolutely. So the Nurse Family Partnership Program is a home visiting program for high-risk infants. And it's already been around for existence for years. It also has a strong evidence base for improving the development of children. We had it in Flint. It was being run by Hurley. It was great, but it could have reached more. It could have reached more children. And when this crisis happened, we're like, well, what are the things that help families? What are the things that improve development? What else can we do to mitigate the impact of this trauma, this crisis? And Nurse Family Partnership jumped to the top of the list. So through advocacy efforts, we got the state to fund more resources for these home visiting programs, and the Flint Kids Fund, blending funding sources, also was able to increase the capacity of that Nurse Family Partnership Program to, I believe, double its impact. So about, twice as many more pregnant moms and children up to the age of 2 were able to benefit from this program. We also worked with our federal partners, for example, the folks that fund Early Head Start and Head Start, to get more resources, to get more of those spots available for Flint kids. So a lot of the things we already had in Flint, but we leveraged more spots and more resources for these pre-existing programs because they weren't enough. They're still not enough. I would love to see a point in time where every single kid in Flint has access to things like home visiting and early intervention and high quality preschool. Our goal really is that these things are at the universal level. We did a lot better, but there's more to go.
No, that's a good point. So I think it's interesting. There were some innovative approaches to the work, and there were some things that we kind of poured on top of because they were already demonstrated models. And so I'm going to pivot to Sue and maybe even Cheryl here to talk about some innovative things that we did, right? The mobile mental health clinics that were funded, those were new. I mean, I think there was one that existed in New York that was actually moving, and they were looking to broaden that model, if I remember well. But we looked at, we not only innovated that practice here, and we saw some amazing things come out of it, but we also looked at Medicaid expansion and supported policy. I think Dr. Mona even found her way to DC to have conversations about Medicaid expansion and why it was important. And this kind of pours over into Cheryl's old lane, the line before she retired, but she's always been a fierce advocate for Flint kids and families, and specifically those who are marginalized or traditionally marginalized and live in areas with high concentrations of poverty, those folks who don't have access or aren't listened to. And so this was a huge opportunity to kind of layer on, if this was the final years of your working at DHHS, this was the type of project that you want to go out on. And so, Sue, if you talk a little bit about the mobile mental health clinics, and then Cheryl, if you can talk about the expansion of Medicaid and how that was important in your work.
Okay.
Sure, definitely. I think we were willing to look at everything, and I do think that the crisis forced our nonprofits who know the clients and know who they work with. It pushed them to think about how to provide those services differently. And the fund was then able to support them in doing that. And I think similar to what you're going to, we don't know yet, but what we'll see in this crisis is because of the crisis, it changed our typical way of doing things. So in the case of the mobile mental health unit, GHS had been, they had their standard buildings and people could come to them for screenings or for, counseling and supports. But what this allowed them to do was take those services out to neighborhoods. They would typically, it was a bus, yes, it was from the Children's Defense Fund. Originally, the idea was they used it during the Hurricane Katrina. So it was typically this bus that was used in communities after a crisis. And so they came to Flint and worked with GHS, and we helped support some of the costs for renting the bus and getting it going here. But when I talked to Dennis, he said, you know what, Sue, this has changed how we're thinking about doing our business. It's changed our business model. We want to continue to bring our services to people. It's removing the stigma of having to come downtown and come into our building. And so it's changed. They actually now have bought their own bus, and they're continuing to do these services now as we speak. And I'm sure it's playing a role in the crisis. So, and the other thing I forgot to mention is that one of the other criteria of the fund was that we definitely didn't want to replace public dollars. And so the idea was we really wanted to fund those things that where there were gaps. And so we could always go to Cheryl and count on her to be our advocate and our best partner and say, hey, what's missing and what's coming? And one of those things was definitely, Medicaid expansion. And without that, I don't think our dollars would have gone as far. So Cheryl, I never still get the details on that. I rely on my, like Cheryl to help me, but if you could fill us in on that.
Okay, well, I think that was one of the most innovative that we were able to come up with to help the residents of Flint. That was for those who lived, worked, attended school, went to daycare, that in the city of Flint, they had to be under the age of 21 and or pregnant and consume the water anytime from April 2014 into a date to be determined because it was expanded. So I'm very happy about that. But I think the most innovative is because we don't know what the effects of the lead crisis is going to be. And this helps so many families that had medical problems. I had one, as a matter of fact, you may have seen a commercial about, I had one father whose daughter was very sick and he didn't know how he was going to pay for it. So I happened to tell him about the Medicaid waiver. He signed up for him. I called him, I don't know, maybe a couple months later, and he said, oh my gosh, Cheryl, I had no idea how much this would benefit my family, because when I looked at those hundreds and thousands of dollars of bills I would have had to pay, and I didn't have to pay a dime for it. So the benefit of it is it's 400% of the federal poverty level, which means for a family of one, it's like $47,000, and for a family of four, it could be up to $97,000. If I'm not mistaken, I think our median income for residents in Flint is about maybe 25 or something like that. So more people were eligible for it than that were low income or even higher income. It's not just Medicaid. So, and I tried to say it's to help everybody. So please apply for it because it helps our community, it helps our kids, it helps our families that may have been affected. And I'll just tell you that how strong advocate, I used to carry the brochures in my purse. So if I'm in the store in Flint, because I live in Flint, for those of you who don't know that, I live in Flint. And so I would carry those brochures and I would hand them out to, if I saw a family with small children, hey, are you aware of the Medicaid waiver? Do you know what this means? To make sure that more people signed up for it. And I still do.
Yeah, and it's interesting. I know we're talking about the Flint Kids Fund and celebrating a 5-year anniversary, but most people will start to overlap other dollars that came to our community with the Flint Kids Fund. And just for the moment, I just want to take a moment, Sue and Dr. Mona, to talk about some of those resources. We receive resources for the registry. We receive resources directly from the CS Mott Foundation to build the Educare building, clearly aligned with the strategy, but those were separate resources. We received $1 million to start a donor advised fund to support Flint kids and families from Bruno Mars. We received $100,000 from the Links to start a Flint Kids Matter fund that clearly align with the Flint Kids Fund. So people will see all of these different dollar or pots that are coming in to support Flint kids and families and bundle them all together. So when I say that over $19 million was received for the Flint Kids Fund, these are just dollars that were advised by this 8 advisory committee member group that I described earlier. But there were other dollars and quite frankly, that have come into the tens of millions that have come on to support Flint kids and families in alignment with this fund. So this fund was much of a catalyst to bring other folks along. Carnegie actually gave us $1 million to support programming for Flint kids and families, which was $1 million, totally separate from the fund, but clearly aligned. And so Sue, if you can talk just a bit about some of those other funds that were established that align with the Flint Kids Fund, but we don't discuss them and they're not ranked in the same way.
Sure, and there were a lot, and we wanted to be transparent with our community. That was a really goal, and it still is. It shows up in our strategic plan to this day, so that we can explain and show how we've spent the dollars. But yes, you mentioned a number of good ones, but the Carnegie grant allowed us to really support literacy efforts. There was a mobile early pop-up early childcare mobile unit that was created, and we're able to support the literacy network for 2-generation literacy strategies. We also help the Flint schools create libraries in their classrooms, things like that. One probably lesser known grants is we also received some money from the Ford Foundation to work with the city of Flint, and so that they could have a public health advisor, so that the city could also be prepared for the next crisis and build the capacity around public health. Kresge similarly helped with another position at the city to really help folks understand where the resources were in the community. So we had so many opportunities that were above and beyond this fund. And I think it's still our transparency, our water report is either on the website, on our website. We have a document because, again, we just wanted to make sure we are transparent about those opportunities.
And Dr. Mona, I will bring you in here only because I remember we had a conversation very early on. I would say this was probably 2015 about, we always talk about the programming that has to happen to support kids and families. But we were having a discussion about something tangible. And obviously now we have this $15 million, 36,000 square foot school on 7 acres just north of DTM that we can talk about or we can point to. But I remember having a conversation with you and Dr. Reynolds at the time about what would need to be included in an early childhood center if it was going to be the best for Flint kids. And the fact that we could have that conversation in a room, I think it was in your office at Hurley, and then leave from that. And at the time, Dr. Reynolds was over at my Children's Health Center. We went over to have a conversation with him. And with the support of the Charles Stewart Mott Foundation, we were able to build a school and continue to build on the best practices for early childhood education. One of those things that is necessary for kids that are exposed to any kind of toxin. Talk a little bit about that process, the conversation, and then the realization of that.
I have goosebumps right now.
Yeah.
It's amazing. If you have not been to the Educare Center, please go visit when it's safe with permission, but it is gorgeous. It is the state-of-the-art brand new facility for our youngest children. It is the largest Educare Center in the country. And it was built very similarly to our clinic, our pediatric clinic atop the farmers market. It was built to tell Flint kids that you are worth it, that you deserve beautiful and gorgeous facilities and new facilities. It includes quite a bit of family engagement and family supports and nutrition support and social work support, everything you need to support our youngest children. I would love to see 10 more Educare centers in Flint. Once again, I'd love it to be universal, but the fact that we have this brand new facility, the fact that it was just an idea and that it's come to fruition really in a very short period and it's already graduated young children is something that I hope we all pause and celebrate. This is something that the community did together. And like Isaiah and Sue mentioned, like the funding for these things, for so many things in the community is absolutely blended. We try to go to the Flint Kids Fund last. Like we write a bazillion grants to all these other agencies. We asked the state government, the federal government. I sat in the office of the Administration for Children and Families in DC trying to get more early Head Start and Head Start dollars with the folks from the Mott Foundation. So we try to leverage as many other resources as possible before we have to dip into the Flint Kids Fund, because we want this fund to last for a really long time.
Thank you so much. And so, Sue, if you don't mind, before we go to questions from our listening audience, and we did promise that we would stick to under an hour here, so I'm going to do that. That way, Cheryl and Dr. Mona actually return our calls when we call them again to do this again.
That works for me.
So, Sue, if we can talk just a little bit about the evaluation and the process that we've been going through. We've been working with our grantees to actually give testimonials or give us information by way of grant reports. And then we've also been working with some consultants around evaluating the progress of the Flint Kids Fund. So just talk a little bit about what we're learning from our grantees and from our consultants.
Sure. One of the many grants that we ended up writing was actually Kresge was willing to support us. And they wanted to make sure that we did evaluate the work of the Flint Kids Fund. So they included that in their proposal. And so what we did over the past 3 years is we worked with a consultant, JFM Consulting I think they're out of Detroit, but they also have worked a lot in Flint. And they really helped us put in a place to really measure and see where we could move the needle along those 4 strategies. And so we learned a lot from that evaluation. We know from outputs and outcomes we've made an impact. I think, but even for as an organization, though, what we learned even more was what we needed to do to work with our grantees to help them be successful, right? So we learned a lot, maybe doing grantee cohorts. The grantees in this particular work wanted to know what each other were doing. I think all grantees do, but in this case in particular, to share information, to share things like that. Also, we realized that in our grant making process, we learned a lot about what we need to do to make sure we are ready to measure impact and that we are ready to support our grantees in ways that make them even the most successful. So yes, we have stories as well, beautiful stories of knowing that we now have books in the home, in the hands of a 4-year-old who maybe wouldn't have. Just the stories that really make the work worth it. My boys were 4 at the time, and we all kind of have our own stories. But just to be able and be involved in this work and maybe had, a piece of moving the needle in one direction to help one family, it's so fulfilling and exciting, as Dr. Mona said. So
I know Dr. Mona has been doing a lot of work in this space as well. I'll tell you, we define impact as the change in the state, whether it be positive or negative, but a change in the state based off of some sort of intervention. And I know Dr. Mona has been doing the state of Flint Kids, right? Which is the change in the state, positive or negative, based off of intervention. And so that we actually tie some of our work that's happening with the Flint Kids Fund right into the state of Flint Kids report card that Dr. Mona and her team has been working on. If you can talk about that a little bit, Dr. Mona.
Yeah, you can check it out at stateofflintkids.com. So one thing, we just mentioned all these bazillion amazing things that we've been able to fund, that other folks are doing from different funding streams. There's a lot happening in Flint. So we wanted to take a step back and say, like, how are we moving the needle? Like, how are Flint kids doing? I think the most common question I get asked wherever I go is, how are Flint kids doing? And often I can tell you about like how one intervention is doing, but it's really important for us to take a step back and see how kids are holistically doing. So that was the impetus for the State of Flint Kids. Last year, we had our inaugural kind of report where we were able to share kind of how Flint kids are doing over time. We did it on Valentine's Day, and we're going to do it again this Valentine's Day. So in about a month, we'll have our second annual State of Flint Kids report. We try to time it after the State of the Union, the State of the State, the State of the City. So this is the State of Flint Kids. And we look at big things like poverty levels and kindergarten readiness and graduation rates and, kids who are, getting as in preschool. And then hopefully, from that report, we then kind of develop action plans of where we need to go. So it's really important for us to kind of take a step back always and see how we are doing in terms of that big picture for our children.
So one, thank you for that. And now we're going to go into a period. We're just going to do some rapid fire questions. Questions for Sue about the fund uniquely, to Dr. Mona broadly about what's happening in the space, and to Cheryl, because we know she's left her last post at Department of Health and Human Services. But if there are questions related to off ramps to state and federal resources, or even understanding community perspective, as Cheryl has been a lifelong Flint resident, we're going to throw those questions to Cheryl, if you don't mind. Right now, I have one question from Woodrow Green. He says, was there any research about what else was in the water other than lead and the impacts? All we hear is lead, lead, lead. I'm going to throw that one to you, Dr. Mona.
Yeah, so I think, the water scientists that came in did look at other things. Obviously, we know about Legionnaires Disease. So Legionella was in the water that killed people. During this crisis, there was an uptick in deaths from Legionnaires Disease. There was bacteria in the water. That's why we had all those boil advisories. All that bacteria in the water increased the amount of chlorine that was in the water. Chlorine was added to kill the bacteria, and just the added chlorine was an irritant for skin and eyes and caused rashes and problems. And people felt like they were drinking a cup of bleach. And then when chlorine gets broken down, you create something called a disinfectant byproduct. So if you remember, we had elevations of total trihalomethanes, TTHMs, which are a byproduct of chlorine metabolism, which is a carcinogen. It causes cancer. So there was a lot of stuff in this water, stuff we know about and stuff that we still don't even know about.
Thank you. Sue, this question is going to go to you. Have there been changes in the strategy as the kids have grown or aged that people should know about?
Yes. So what we've done is we've again followed the guidance of the committee, and what we do is we revisit the strategies annually to make sure that we are meeting the needs. We went back and forth, I think, on whether we follow the cohort of kids impacted by the water crisis. But I think where we ultimately landed is after everyone reading Dr. Mona's book, was that the children are impacted, all children in Flint are impacted with multiple traumas. And so the idea was that we broadened actually the age group, knowing that the kids were aging and all children in Flint were really impacted by this. So you'll see that education, we really honed in on early childhood. I will tell you the work of Educare is not done. We are planning on making sure that those are 2 buildings, but what we're learning in those buildings, we need to get across Flint. But in those cases like that, so education we broadened, still looking at any access to medical homes, that's still in place. Access to healthy food was much more important, probably immediately after the water crisis, but still is a concern, making sure that folks are staying healthy and have access to the foods. And then still family supports. And I think that shifted over time. There were probably more immediate needs when we looked at that strategy of folks needed documentation. They needed to get a copy of their driver's license to be able to apply for Medicaid expansion. All the way to now is, well, let's look at literacy and possibly workforce development. So I think the committee was pretty smart. I think they know, but they knew the right buckets of interventions, and we've just kind of had to tweak them along the lines. I will say what has changed is we now have an RFP process. So we're asking for grantees to submit at specific times, but all of that information is on our website. It's helped us to be a little bit more strategic, I think. So we've definitely tweaked things along the way, but for the most part, would say the buckets have stayed the same, or the 4 strategies.
Okay, I have another question. And Sue, you might have this one. Dr. Mona might chime in here. What strategy did all of those playgrounds fall under? I would even add, if you will, why playgrounds? Maybe you can answer that as well.
Yeah, Dr. Mona, do you want to start?
So play is important for child development, and our development and behavior pediatrician actually jumped in on this one as well. Kids need to play. Kids need to be kids, and a big part of that is play. So play is treatment. We need kids to just go outside and have fun and be able to enjoy themselves in safe places. So that's why kind of playgrounds were part of that.
Yeah, and I don't know that I can add much more because that was the science that we followed. Just a thank you to all of the partners who made it happen, the City of Flint and the United Way, to really partner and make sure they were in locations where the families needed them and use them.
I'm not going to add a whole lot here, but it's interesting how we find, this idea of our immune systems and how we build the necessary, I would say this, talking about vitamin D. I remember lots of conversation about being in the sun, getting vitamin D. And I'm hearing a lot of those conversations right now as we think about vaccine around COVID. And so it's just, how do we get those vitamins in our system? That way they can fight back against many of these toxins that can be getting in our body. And so again, the next question is, can you repeat the 4 strategies? So Sue, if you can walk through again slowly the 4 strategies.
Sure, and then at any time, Lydia Stars is our program officer who is now managing the fund. She put them in the chat.
Already put them in the chat.
Yes, she knows that I won't remember, so she already put them in the chat. But education and literacy, and as a reminder, we really did focus on early ed, but we're looking at all broader strategies around what works and what is the most impactful intervention for our families. Access to healthy food, including breastfeeding. We sometimes go back and forth with breastfeeding. Is it still important right now, knowing the cohort changed, and it still is? I always look to Dr. Mona for that. Access to medical home and developmental assessments. Interesting, Cheryl was chatting me and she was wondering what types of grants we had made around this. And I'll be real honest, at this point, it's been somewhat limited. I think the public dollars have really helped to support our local CHAP model that reaches out and provides case management to families. But we're still keep our eyes open and always look to Dr. Reynolds and other members on the committee to keep us informed if something does change in that space. And then finally, family, social, and emotional supports. And anything in there, again, as I said, has been anything from helping folks get documentation to apply for services to now thinking about maybe workforce development and ensuring that our families are employed as part of the solution. So
So Sue, I've got a second question, and this one is for you for sure. So how many children does Educare serve, and will children have access to high quality early learning and care in high poverty areas, North Flint? And I would actually add that you not only talk about Educare, but talk a little bit about FECC, the Flint Early Childhood Collaborative, and the Lift All Boats model in your answer.
Sure. And then quickly, I did forget, Lydia, let me know that we do have a new area for grant making, which is special projects. So that to an eye for those grantees who are finding something that we may be missing in an intervention that's needed, that we can also look at it in that bucket. But yes, so as I mentioned, so there are about 220 students at Educare and about 250 roughly at Cummings. So we have the two sites that really came about. Cummings came online first and then Educare. And just as a reminder, it's what we talk about by high quality is all year round, 8 hours a day, and with wraparound supports. Now, of course, because of COVID, they're just going back today, this week, I mean. But they've been able to keep working with the kiddos. And once you get into this Educare world, you start using the word kiddos, but they're doing online connections with the families, which is great. But the idea really is, one, there was a lot of thought put together in the location of the Educare site, and studies done. And so the capture area, the catchment area of how many students within a certain mile radius would be able to use that site. And then that was one thing, and that really factored into the location. The other idea that it was by Durant to Remote, so we could prove make some handoffs to kindergarten through the Flint Community Schools. But as I mentioned, we're not done. There is a collaborative, the folks who kind of came together with the idea, the Charles Stewart Mott Foundation, GISD, Flint Community Schools, and then CFGF, really continue to monitor this. And the goal has always been, we say lift all boats, but it's to get beyond the walls of these two sites. And maybe it is going to be a new building down the road. I don't know, in North Flint, we'll see. But in the very least, we can take what we learned and share it with either home providers, already existing providers, and then use these two sites as a hub for learning as well. So the other thing is that there's a big policy piece that is going to change. This is pushing the state to look at how it is funding early childcare. They are now looking at how they're doing contracts differently. So I do think that it's going to lead to some things that will increase quality early ed in all of Flint.
No, Sue, that is a really good point. And I will throw to Cheryl here because she has been really helpful in helping Flint to navigate how we position things at the state level. Quite frankly, the goal here was not to just have the philanthropic community continue to fund early childhood education, but to demonstrate or model how we thought early childhood should be funded. That way the state the risk of doing it the first time was landing on philanthropy. But once we've demonstrated that it could happen, then the state takes on those practices. And I'm not sure if that's working, but I do know that the state of Michigan did make a decision just recently to reinvest in early childhood education in ways that they hadn't before. And the hope is that those dollars don't only go to organizations that are backed like an Educare, that they go to all early childhood service providers. When we start talking about a reimbursement model, we're talking about making sure or ensuring that the reimbursement model that isn't working for everyone else, it doesn't work for Educare, but it doesn't work for Reggie Flint on the north side of Flint either. And so how do we make sure that he gets some upfront dollars to handle business and provide services to students up front without having cash or restrictions or barriers to providing those services? And so all of this is about modeling the behavior that we want to see happen, not only at the state and federal level, but locally. I don't see any additional questions. Oh, yes, I do. Can any Flint resident, parent, or caregiver participate in support groups if children are not physically enrolled in Cummings or Educare? That's a question for you, Sue.
Okay, Flint resident. I think we could, yes, let's get them connected. Let's talk to, let me just, we'll get you connected with Janelle, who's our director, and he can help us figure out what opportunities there are for that.
Yep, we will do that, Carol. And so without a ton of other questions, I want to thank our panelists, Dr. Mona, Sue, Cheryl. Thank you so much for being here with us again. It's 2:05. We promised an hour. We did start a little late, and we're going to end just a little bit early to make sure that when we call you, you answer. So thank you so much for joining us. To the listening audience, thank you for coming on board. Lots of information available on the CFGF website, www. I sound really old now by saying that. CFGF.org. A number of tabs to pull on if you want to get specific information about grant making that happened from the Flint Kids Fund over the last year, or grant making that happened from any number of funds. Please jump on the site, check it out, and always feel comfortable calling us at CFGF if you have specific questions. Again, thank you all for joining us.
Thank you. And give. If you haven't given in a while, please give. This is a long-term fund. So flintkids.org. Give.
Thank you so much, Dr. Mona.